sort of worries and anxieties and restarting things after not. And some of our patients, we've been focused on couples. Some of our patients are not coupled and thinking about getting, potentially dating again. And what sort of is, as people are thinking about that transition and have gone through, a lot of our patients have gone through surgery and chemo, perhaps before they had treatment, they were premenopausal and now they're menopausal, or they've had radiation and so they've had a lot of tissue changes, or it's just been time. And what do you recommend to people as they're sort of saying, you know what, I want to start dating again. I want to think about, changing this component. What are your thoughts or recommendations?
I would say start with yourself. We do tend to focus on partnered sex, but to be realistic, most of us engage at some point in our life with solo sex, which we call masturbation. But that word has such a negative connotation. And I think it's an excellent way to explore the changes in your body, to get comfortable, to get reacquainted, so that you can tell a potential partner, if that's what you decide you want, what you need, what works for you, what areas to be careful of, and even to really address for yourself where you feel insecure, because most people come through cancer treatment or any other chronic illness that affects their sexuality often feeling very vulnerable and feeling very insecure about how either an established partner or a potential partner may respond. And dating is intimidating enough without being concerned about what happens when we get to sexuality. So yeah, start with yourself. And I think you'll be pleasantly surprised at how most partners are not thrown off that you've had this happen in your life, that you've undergone treatment, that maybe your body functions a little differently than it used to. They're not going to know how you functioned in the past, and every partner is different. And oftentimes we also forget, for those of us who might have vulvas and hysterectomies and changes in our vaginal functioning, that in similar stages of life, if we have male partners, they're going to be facing things like erectile dysfunction. And if we have female partners, they're also going to be facing menopausal changes. So we're all in this changing body thing together, and it's okay to talk about it. And it's okay to say, sex is going to be different, but it can still be just as satisfying.
You almost wish I could end on that because that's such a great line, but we still have more time, so I don't want to end. Can we go back a second to moisturizers? Because we talked about, for lubricants, we talked about water-based and silicone-based, and we mentioned moisturizers, but, I have patients ask me, like, I heard I can use coconut oil. I heard I can use vitamin E. Are there other moisturizers that are worth talking to someone's doctor about or asking if they're appropriate, or those water-based moisturizers are really sort of should be the focus? If somebody says, well, I want to avoid all those chemicals you mentioned, can I use something else? What are your thoughts on that?
I have mixed feelings about kitchen products because they can also be just as harmful, even though they're natural, as some of the chemical products can be. And we haven't really looked thoroughly at them, but on the upside, they are more readily available. I tend to not recommend things as much that we don't have a history with, to know how our body's going to respond to them. Teasley may have a different viewpoint.
I find that individual, preference for a moisturizer, one recommendation isn't going to be fit everybody. And so sometimes also it will just take some trial and error, different things. Now, I can't say, go ahead.
Oh, the other thing I think is important to point out when we're looking at moisturizers and lubricants, A lot of us still need to use condoms for safer sex practices, and a lot of lubricants and moisturizers that are not commercially produced are not compatible with condoms. So you may be putting yourself at risk of condom breakage. So I apologize for cutting you off, but I think that's an important thing for us all to consider too.
Absolutely, absolutely right. So, for example, you were talking about coconut oil or mineral oil or any of those oil-based products can have a potential to degrade condoms, which yes, absolutely, that's a really nice point. I'm curious if you have any experience with moisturizers like hyaluronic acid.
From working with clients, they really seem to be very effective and very satisfied with these. There's not a lot of research, and most of the research that has been done by the companies who are trying to sell them. But they do tend to be more favorable outcomes. And so I'm a fan of the hyaluronic acid containing moisturizers. Yeah.
What about some of the things you see on that, you know, we all sort of hear the ads and see like DHEA and Asphena based products? What do you, when you're dealing with cancer survivors in particular, what are your, you know, thoughts or cautions maybe about those products? What do you tell them?
So I think they can be very good options, but I always recommend that you talk to your own oncologist because they know your cancer history best. They know your hormone susceptibility